welcome to the office.
Sumit, welcome to the office.
Yep.
How can I help you?
All right.
Yes. So what's going on?
So I've had lower back pain, especially on the right hand side,
Okay.
for a very long time. I had a accident with a big truck which ran over my foot, right foot.
Which was when?
When I was like 15 years old.
Okay, so you.
That completely damaged the muscular structure of my foot.
Okay.
So you would see a higher curvature on one side and relatively flat on the left hand side.
Did you fall when that happened?
I know I was actually sitting behind the bike, and in a red light, just the truck went over the foot.
Did you fall?
No.
Did you slip? You didn't trip
No.
or anything?
You
Okay.
had to just shout to remove the tire.
Okay, so that was the first trauma you remember.
Yes, I think, and then nothing happened. The only thing I would remember is when I was like 19 years old, I was sitting in for about a couple of hours, and then I just couldn't stand up. That went on for like 3-4 days. If I stood up, I could not sit. But then it was okay. Then after every 2-3 months, there will be an episode which will keep on happening. When I started work, which was like 21 years of age, I had to almost every second day wear that belt.
Madam, do me a favor, stop. No phone, please. 21 years of age, you started working.
Yeah.
What were you doing?
I was a medical rep at that time.
Incidentally, he studied pharmacy.
Yeah, I'm a pharmacist by education.
So I have a pharmacist coming to the chiropractor. Why is the pharmacist come? Now the real story comes out.
So
Bolo.
obviously when I was as a medical rep, I could walk into most doctors, right?
Sure.
Most people at that time said, you have ankylosis spondylosis. That was one of the
Ankylosing spondylitis. Yeah. What's going on right now? Like, why are you here?
Right hand side has gone considerably weak.
Okay. So the right leg is weak?
The whole right side of the
Your
body.
whole right body is weak.
Yeah, and it pains very consistently on the lower back right side.
Okay.
But I know even the right arm is weak, right leg is weak.
Whole right side.
Whole right side.
Anything on the left side?
Left hand side, it's only when I play cricket. When I run a lot,
Okay.
the left will also sometimes misalign or something. It pains, and then I can walk for 2-3 days.
Okay. What meds are you on right now?
Any painkiller at that point. It can be a diclopara, it can be, and I usually do diclopara mostly.
Okay. Your number one reason of being here is your whole right side is weak.
Yeah.
You have pain going down the leg as well, I'm assuming?
Now it's not as bad.
But it's still there.
Still there.
Okay, but you can deal with that.
Yeah, I can do that.
Okay. What else? Neck? Sleep?
I think neck is there, but I don't think neck is a reason because of that. I'm sure there is a neck is laptop and mobile and many other reasons.
Okay.
But
So your main reason to be here is your low back?
yeah, if I stand, you will see the body is one side is dropping.
Okay. Let's go over your x-rays. Let me explain
Yep.
what's happening. We're going to look at your body. We're going to see what's out of balance. I think things will make a lot of sense. However, you're saying right-sided body. So this is what's going to be interesting because it starts in your left foundation. Come over here. Have a seat, sir.
Yeah.
Now, I want you to think of this as your 24-story building. You're telling me everything is right-sided, yeah? If we go closer to take a look at actually what's happening on the right side, what are some of the things we can see? You do see that this whole right side is tilting, so I'm assuming that all these muscles on the right side are tight, stiff. You wake up in the morning and things pop a lot, right? When he gets up and gets moving. Okay. And all of this is actually the compensation. This is not the cause.
Correct.
Okay.
Let's go down to the foundation. We have digestion to talk about. That's also an issue here. But let's look at the foundation and what are some of the things we can see. We can see the crease is off the pubic bone. We can see the left side is tilted. Yeah? Right side is higher. We have a little bit of, we have more, you're putting more weight on your hip sockets because of the alignment, and so we're getting this thickening. This is called enuberation, right? When I start to see that, it just means there's a lot of uneven load being put on the pelvis and the hips. Let's look at the numbers. Okay, here you go. So we have a PI EX on the left. We have a drop sacrum on the left. We don't have rotation. At the current moment, we have a 7 millimeter leg length discrepancy. Left leg is shorter. Correction of your left pelvis will get it up to 4. And we need to be under 7, right? In the Gonstead work, we want to have, there shouldn't be more than a 7 millimeter difference between right and left side. Also, the fact that we have a little drop in the tailbone tells me there was a tailbone injury at some point. And I'm going to go to the lateral x-ray to show you. But here's the thing. Let's look at it. Left side goes down and out. If the left is down, the right is up. If the left is out, the right is in, right? They work in opposite. Now, let's go to the side profile and let's look. Well, there's your answer, man. You have your L5 disc is almost non-existent. It's fusing to your sacrum. But we're not there yet. So you see when we're looking at your tailbone, right? This should be a smooth curve. There's a little nub here. I'm going to show you on your body where it's about S3, S4. That's one issue. Okay. When we go to your foundation, this is your L5. You see the disc here? This is good. This is a 35-year-old injury, sir. At least 35 years old. And we got to get movement in your L5. And the sooner we can get to that, the better. Okay? You're here for a couple of weeks, you said?
Yeah.
It's going to be spicy. You okay with it?
Yeah.
There's no painkillers here.
That's fine.
It's only achar. Lots of achar. Okay. All right, so here's our plan here, what we have to look at. Left pelvis and sacrum. And between the two, we need to figure out where we're going to start. We are going to have to lift this up and get this at least a couple millimeters under 7. That way all his adjustments will hold. Okay? Okay, this is your lateral x-ray, sir. On your lateral x-ray, we're designed to have 60-degree reciprocating curves. You don't have the curve. You actually have a straight spine. This looks more like my motorcycle riders' bikes. That's why I asked. And then from here, we have anterior head carriage. So let's talk about this, sir. So this should all be lining up. What it's showing us, this lines up close here, but your neck, which should be around here, is over here. It's almost a 25-degree anterior head carriage. For every 1 degree of anterior head carriage times 10, that's how much the lower cervical spine feels. So he's carrying around 250 pounds of stuff on his shoulders. Okay, that's not good. And because we don't have the right curve, what's taking up all the force is L5 disc, which is wearing out. So we got to start getting some curve in there and get movement in that L5. Your job while you're here, you have work and stuff, I'm assuming, but your homework, not your job. Your homework is going to be 10,000 steps a day. The more you're going to walk, the better results you're going to get. Take?
Got it.
Thank you. Now let's look at the rest of your disc. So we said this is thinning out. We have to stop further progression. 4, 3, 2, these are fine. There's a compensation there, the curve. These discs are fine. We have a little compression here. You played hard, dude. You played hard. So when I'm looking here, we look at these, right? So 2, 3, 4, C5, C6. Both of them are pretty significant in terms of being diminished. So let's figure out which is the neck issue here. We did flexion, extension, or motion studies, right? This is neutral. This is extension. You don't have any movement, dude. It's stiff. But when you go in extension, it pinches back here and here. Let's see what happens. Ah, there it is. So here's the answer in your neck. There may be upper cervical stuff, but you see that one didn't move. That one didn't move. They should all be moving forward. It's still tilting back. So we have 2, 3, 4, 5, 6. We have C7 potential. We have left pelvis. We have S3, S4. These are just potentials I'm seeing off the x-ray. We obviously have to examine him. Now, let's talk about what's going on here. Digestion-wise, this is the Blvd. It's about it's about a third of the size it should be. This is all undigested food going across, producing gas, so we're not absorbing and assimilating our nutrients as well.
Doctor, I had a question.
Please.
The digestion has got anything to do with his condition, or it's just unrelated?
It's all part of it.
He does have a issue with his digestion.
I know.
He struggles quite a bit with that as well.
And part of the pain in the body is from it. We get inflammation from our foods, right? Okay. And a lot of our vitamins are produced in our colon. Yeah. And it's not even just for today, because he's still relatively young. This is like 10 years later. That's what I'm more concerned about. Yeah. So it's all related. Okay. And he had a lot of stuff happen, active. And what I see here is we have something at the base, C7. We have the base of the foundation, and we'll deal with something, whatever we find here related to his digestion. Okay? Along the way, you have questions, you ask. If you're uncomfortable with anything, you please tell me to stop. Yep. Starting at the base of the neck. And the first thing we're getting is 15 points, C7, left side. 20 points, C7, left side. Head down, sir. T6, T7, 8 points, 9, 10 points, left side. There it is, sir. 13, 14 points, S4, S5. S4, S5, T6, C7. Let's go ahead and do static palpation. Sit up straight, sir. And you can tell, just look at him from the side here, even, Shasha, when you look here. He's just hunched forward. That's his normal posture. And you're on the computer a lot? You're at the desk?
Yeah.
Yeah, we have to change a lot of habits, because those habits got you to this point. Static palpation, running my fingers down the spine. This is all inflammation. All of this, guys. All of this is swelling. So that's where the food will become so important, to get the inflammation out of the body. Static palpation, you can see all that pooling. All that right there. Beautiful. More tender when I push here or here?
Top.
That's 6 or 5? No, 6. So what's happened, sir, the pressures are on the left that have caused a lot of the compensations on the right.
Okay.
Yeah.
You always thought the other way around, no?
It will always be compensation on the other side.
Okay.
That's the body's.
Body's amazing, isn't it? Right. Okay. Punch. We know it hurts. Ek. Punch. 5. 1, 2, 3, 4, 4, 5. That's down in the, way down in the basement. We're starting at S5 down here. S5. T6, S5. Scoot forward, please. Let's check general motion of your pelvis. Feet together. Open and close your knees with your feet touching. Open and close. Right side only. When he does the right, the whole left is shifting from the fixation. Left side only. When he does the left, there is some movement here, but that movement is actually coming from more here. You should be feeling it's more stuck on that left side. Okay. So S5, T6, sit back for me, sir. Okay, all the way back. This is how I want him to be. go light now. Jawa.
Cramp.
Cramp?
Mm-hmm.
Where? Come. Cramp is here.
It's okay now.
Can you see? You see that? So for him to sit back straight,
Yeah.
he cramps, right? Is that the first time it happened like that?
No, it has happened previously also.
Huh, okay. 7, 6, 7. 7 right, 7 left. 7 right. Okay. Let's take a look at the listings on the x-ray and let's see where we're going to start. Let me formulate a game plan. Shasha.
Hey, Dr. Wright.
We're gonna do S5 sacrum as a pull move. You know the cobra is back this month, right? Now let's look at his T6 and C7. C7, you can. This is T1 tilted this way. C7 is a PRS on the right. 1, 2, 3, 4, 5, 6. 6 is a PRS also, so I can justify both our PRSs. If one wedge was opposite, so if the neck wedge was opposite the thoracic wedge, I probably wouldn't have adjusted the neck. So they're both PRSs, I can justify that.
What's PRS?
Posterior right superior, so the way the misalignment of the vertebrae is. The vertebrae, it's a Cartesian coordinate system, right? It works in the 3 planes, X, Y, Z axis. So we have flexion, extension, lateral bend, and rotation. Mm-hmm. The misalignment of the listing in the Gonstead system, it's a static listing. And the static listing tells us which way it's misaligned, which way to correct. So it's gone posterior, back, right, and the wedge is on the right. So PRS, it's on the right side superior to the wedge. Mm-hmm. If it was down on the left, it would be a right wedge, that'd be a PLI. Okay, so if it's gone back, right, and up, which way do we want to correct it?
Opposite.
The opposite way. That's it. Okay. T6, C7, S5. Stand up and let's see. You got that daily wiggle. Stand right over here, please. Turn this way. You're going to walk to the corner of the room and back 2-3 times, and let's just get an overall view of his walk. Turn, keep going. And this is his regular walk, madam?
Yes.
And he looks down when he walks?
He mostly does.
He doesn't hold the head up? Is that because of all the traffic and stuff on the streets in Delhi? Just so he got a little wiggle, but the main thing in his walk is he's got no power. He's like, he just drags himself. Like it's a chore, it's a burden to walk, right? That's the energy I'm getting out of you.
Some days I may have more energy, but that's only when I wear shoes. Without shoes, I will always struggle.
Okay.
I don't know why. That's right. If I want to be energetic, I have to wear a shoe. If I wear a slipper, I will always be dragging.
You ready?
Yes.
Chalo. Let's start with the neck. C7. Have a seat over here. Sit back. And we're going to do C7 as a PRS. Scoot your bum all the way back, please. Scoot your bum back. Good. And let's put the right hand up. I got to put a seatbelt on. All the way back, sir. Lift the hand up. Now, again, because of his anterior posture, I got to bring him back. Okay, hand down, please. Palms up. You good with that? You okay?
He cramp.
Cramp where? Low back? Okay, let's switch it up. No problem. Walk it off once. Let's do the low back first then. Now you have one thing to do. Just relax the best you can, boss. All right. There it is. S5. And because it's down on the left side, I'm going to do a torque up. Okay? Nice and easy there. Let it roll. Good. Gotcha. Nice. Come up slowly. Push yourself up. Let's walk it off once, please. And let's go face down over here. They say the sacral segments are all fused and you can't adjust them. Did you feel that thing move?
Yeah.
You did, right?
Yeah.
Okay. Da-da-da-da.
It's cramping.
Get there.
Yeah.
All right. Let's do 6 then, okay? 2, 3. That one more, or that one more?
6.
Drop the hands down. Home run, baby. Step back. Let's walk. And let's go back down one more time. Let's get a little more of S5, okay? I gotta go a little deeper on the low back. Slide up, please. Bus. Are we good right now?
Yep.
Good. S5 with a little twist. Let's use the drop. And the reason I'm using it is just to make it a little easier for him. Oh, home run, baby. Got you. Shukr. 4, 3, 2. That's the rest of it. Step away from the group. Chill. That's walking. That's moving a little different. Okay, have a seat here. Let's see if we can get the neck now without it cramping. Is that different when you're sitting, sir?
Yeah.
Yeah. C7, PRS. Doo-doo. Oh, wow. You crack your neck a lot.
Yes.
Yeah. It's Cairo. Let's go fish. I used to be able to say that in the early millennium. Now you can't say those things anymore. They like it. We got a self-cracker over here, right? We got a self-cracker. That means I can't really get him over there. It's too hypermobile. If I do it there, it's not as specific. We'll do it here. Mm-hmm. Slide up a little bit, sir. There you go. Chin down. That's what we wanted. Good job. Let's walk it off again. Now, this time as you're walking, Sumi, tell me what's different. Anything different in anywhere in the body?
It's moving easily. There's no stiffness.
Okay. Meaning the back?
Even the hip joint.
Okay. Can you try something for us?
Yes.
Can you sit on the wall under the picture, please? And the test is not the sitting. Okay? The test is it should be easy to get up faster. Get up. Easier?
No.
Madam?
It definitely is.
Looks easier, right?
He can't sit down.
I know.
Actually.
And he's not going to tell me all this. You're going to have to tell me it, okay? Have a seat, sir.
It's a struggle for him to sit down on
Yes.
the floor.
Yes.
Getting up, I haven't seen much because he doesn't sit down on the floor.
He doesn't really sit? You have a sit-stand workstation?
Yes, I have. I have.
And how many hours of screen time?
16, 18.
Not 16 hours of work.
Screen time.
Screen time is, I think, 12 hours.
16 hours of work.
12 hours, no? At least.
6 is clear, 7 is clear. Heat, but no break. All right, let's take a look. Sit up straight, sir. This is how I want him to be. That's how he should be, like this. Come back slowly. Nope. Sap. Oi. Back towards me in extension. Back. Come back. Back. 5. Let's see. Different?
No.
Yep. 2. It's actually moving better. 3. Jar. 4. 5. Different. Nice. Shall we continue?
Yep.
Ears. The ear adjustment. Nice. Let's go on your back over here, please. Cool. Raise your left leg. Awesome. Stay there. You want your nose job today? You want your nose job today? You have deviated septum, sinuses.
Yes.
Would you like me to help you on that?
Yeah.
Okay, too. You used to box?
No.
What's this from?
This is cricket ball.
Cricket? Is that dangerous?
No helmet.
Look, no, you stay back. Look, I have something similar. But that's from go-karts. That was from go-karts, grade 4. Still have it. It's always a reminder. Grade 4, go-karts, gushing blood. So, let's go ahead and check the septum. And now, when we go this way, and that, it's stuck on this side here. And what we're going to do is, if I push on this side versus that, that's where it's stuck. Do you feel that, sir? Yes?
Yeah.
Chin down, please. Bas. Gotcha. Breathe in. Come on up, please. Walk off that nose job. Yeah. Questions?
You just by looking at it, you figured there is a deviated septum, is it?
That's what I do, madam. Have a seat. Now you get the buff and polish. So this is vibration therapy. The magic frequency, 10,000 RPM or 170, 180 hertz. That breaks up the scar tissue. Squeeze, relax there. Let's do the elbow. Let's turn a little bit this way. Let's get right there. Relax the elbow. Relax the elbow. Good. Wrist, thumb, elbow. Let it go. There you go. Go like that 5 times. Squeeze. Better. Squeeze. Squeeze. Different. One more time. Awesome. Set. Questions?
No questions.
Welcome to the office.
As long as, how will this sustain? That's a key question because I'm sure you've done some magic. How does the magic sustain?
It's not about it's a process we just started. So the idea is just like braces, just like anything else, right? We're going through a process. It's someone comes in, they have these injuries. They've hit these potholes in life that causes their body to go out of alignment and compensate. We start to fix the alignment. We obviously have to change those habits.
Yep.
Right? You go get your car aligned, you change the tires, everything is good, but you keep driving to work and hitting the same potholes. What's going to happen?
Yep.
So we're going to go over that through this journey, okay?
Yep.
The idea is I'll get as much work done with you while you're here.
Mm-hmm.
Then we'll give you some instruction for when you go.
He stands like this more often than not. Is it to do with the alignment only?
Everything has to do with his alignment
Okay.
and habits. So we're changing all of this now, okay?
Yeah.
Okay? All right. You guys take care, enjoy your day, and I will see you tomorrow.